Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Are there certain types of cancer that are unique to men?
There are two cancers that are unique to men. Prostate cancer is common in older men. Testis cancer tends to be common in younger men, both of which are important health concerns, especially if you're someone who develops these cancers.
How prevalent is testicular cancer?
Testis cancer is on the increase. The rates in the United States have been increasing over the last generation. No one's quite sure why, but obviously thoughts come down to toxins in the environment, diet, and other types of issues.
Should one self-examine for testicular cancer?
Most urology and urology groups do recommend occasional self-examinations. Other groups, such as the family practice physicians, the American College of Surgeons, aren't as definitive or positive about it. The problem is that it's never been studied in enough detail where there's any evidence to show that self-examinations have improved earlier diagnosis. Fortunately, testicular cancer is an extremely treatable cancer. About 95% of men who develop testicular cancer across every stage possible will be cured of the disease.
What are some risk factors for testicular cancer?
If one has a male relative with testicular cancer, that slightly increases the risk. If one is born with a testis that hasn't descended or dropped into the scrotum by the time one is an infant, that also increases the risk of testis cancer.
If you feel something is not quite right, what should you do?
The first step once feeling something abnormal would be to talk to a doctor. If someone and their partner felt a lump or a hardness within the testis itself, I would recommend they get seen by a doctor. If the doctor confirms that it's abnormal, we would probably get an ultrasound and then kind of evaluate things from there.